Today we're going to show you how to perform a fine needle aspirate, which is also referred to as an FNA. This dog has a lump behind her elbow, which you can visualize here. I'm holding it in my left hand. This is a procedure that is well tolerated by animals because it really doesn't cause much pain. It's the same type of procedure as we would use for vaccinating a dog, where we're simply sticking a needle into the skin and tissue. The reason for performing a fine needle aspirate is to obtain cells to allow us to do a cytologic evaluation under the microscope of those cells and try to arrive at a diagnosis. So the first step in this procedure then is to have a syringe and needle. So I have a 22 gauge needle, and one can use a 22 or down to a 25 gauge needle. We should not use a needle larger than 22 gauge because that will result in blood contamination of our sample. And that applies also even to large animal species, where one might think that you should use a larger needle, but it is definitely not necessary. Then you'll have a syringe, and the syringe can be 3 mils up to 10 to 12 ml in size. So we will prepare to do the aspirate by assembling our syringe and needle by attaching those two together. Then you will take the cap off of the needle so that you're ready to do your aspirate. Then you want to immobilize the mass in your left hand. For me, I'm right-handed. So we will insert the needle into the mass. Then we want to apply negative pressure as much as we can. Then we will redirect that needle within the mass, usually 2 to 4 times. Then we'll release the pressure on that needle. Then we'll withdraw the whole unit from the mass. Now that we have our fine needle aspirate performed, we need to demonstrate to you how to make cytology smears. And these are usually done using a slide over slide technique, which is what I'm going to show you in a moment. Some people will also make smears as you would for a blood smear, and that can be used sometimes, especially if you're finding cells disintegrate very easily on you when you're making smears. So the steps involved to make your slide over slide smears are, first of all, to detach the needle from the syringe, fill that syringe